on this journey of learning to love our city, love our neighbors, and give God all the glory. Uh, are you enjoying our educational journey?
Yes, I am. Sorry, I'm trying to get
Yeah,
this to work.
yeah,
So,
you're keeping busy back there. We're on YouTube Live. Kenny on the board is working our YouTube Live, our Facebook Live on YouTube. We're at the channel is 915 Talk. It is possible to watch the radio. So through the miracle of modern technology, on Facebook we're at KELP Christian Radio, and I can hear you talking to Keith right now.
oh,
Yeah,
sorry. I
so
was trying to whisper.
so today we're going to be talking about community health. Kenny on the board.
Okay.
Yeah, and we're going to be talking a lot about diabetes.
I love it.
Yeah,
It's a big problem.
that's a fair way of putting it. We have a doctor in the studio. Now he's not a medical doctor, and I'm just going to get this out of the way. Uh, Nothing in this program is in any way to be construed as medical advice. It is for informational purposes only, and nothing in this program will in any way replace the advice of a medical professional who understands the specificities of your situation. So if you do require medical help, go see a doctor. We're just two guys talking. But our guest today has a doctor of philosophy and health education. He's over at the Paso del Norte Community Foundation. He's also, Governor Abbott just reappointed him to the Texas Diabetes Council.
Well, congratulations, sir.
Yes. So there's a lot to talk about community health education. We will be talking a lot about diabetes, but it is important for us to be educated on these things and how we can become healthier as a community. So without
Yes,
further
it
ado,
is.
let's give a very warm Borderland welcome to the one, the only, Dr. Michael Kelly. Dr. Kelly, welcome to 915 Talk.
I appreciate being here. It's good to be here.
Yeah, very good to have you on. We have a lot to unpack over this next hour, but let's start off. What is the Texas Diabetes Council?
Oh, so the Texas Diabetes.
Hold on, Kenny. We need to get his mic. It is okay.
My mic is on. My mic is
Yeah.
on.
Check. 1, 2.
Am I on, Kenny?
No. Yeah. That sounded closer.
Am I on?
Yeah, there
Kenny?
we go. There we go. Dr. Kelly, good to hear your voice. So tell me about the Texas Diabetes Council.
Sure. The Texas Diabetes Council is formed by legislation. Am I off again?
Mhm.
Am I go off?
You had him, and then you lost him, Kenny. Yeah.
Yeah, okay,
Yeah,
am I
there we
back?
go.
Okay,
Yeah,
I'm back.
Yeah.
So Texas Diabetes Council. It's formed by legislation and reports straight to Governor Abbott. And
Wow.
And our role really is every couple years we put together kind of some priorities and plans for the state of Texas for the legislature and the governor. And many others in the public I can say something about to consider this plan. It has data in it, but more importantly, it sets some priorities for the state. So over the next couple of years, the priorities are really around diabetes management. So if you have diabetes, this current plan calls for managing that diabetes. And you know, if you're like a health foundation, which we are, we can talk about the foundations later if you want. But I work for a health foundation. We look to some of these state plans. We have state plans on obesity and many other things, and we use that plan to say, hey, communities need to be pulling kind of in this general direction. And it, like I said, lets the legislators know too, hey, we may need some policy in this direction or support.
Okay. Wow. That's I have like 10 follow-up questions.
One at a time.
Yeah, exactly. I do want to talk about diabetes management. I want to talk about policy, but let's talk about obesity.
Mm-hmm.
Is it possible to create legislation that will actually affect obesity?
A short answer, yes.
Uh-huh.
So when we're talking about obesity is classified as a disease,
Okay.
all right? So it is a diagnosable disease today, and when we talk about like behaviors, say what you eat and how you exercise, contributing to obesity, there are many different ways to affect this. So policy is one of them, and policy is important. It's very powerful. It can backfire on you, so you got to be real careful. I think it should be used judiciously. But yeah, you can pass policy that really can help people eat better. We have rules in the United States about food labeling.
Okay.
I mean, so, I can look at a food product and tell, oh, that's a lot of calories, right? And, that's because of policy. The kids at school, and you can say about the taste of the food all you want, but policy drives the quality of the food, the nutrients that are in it, and that's really important for us. And there's emerging legislation on like when we give SNAP or food stamps or whatever out to people, like what kind of quality we're looking for, so we're not handing out just a bunch of junk food.
Oh, interesting. Yeah. So as far as I'll call it government aid for food purchasing, I know very little about that world, but essentially what you're saying is making it where those government subsidies, that government assistance will not go towards junk food.
Right. I mean, so some of the programs are very narrow, like women, infant, and children programs, or what we call WIC.
Okay.
You can buy a few different foods that are pretty important. When you get to SNAP, if it ever gets funded again here, Texas has some emerging rules around like what you can use your SNAP dollars on. Of course, you can't buy beer and cigarettes, and,
right?
But that's going to become a little more clear later on what that policy is going to do for obesity.
Right.
But policy's really important. Individual choice is equally important.
Yeah.
And culture is really important. And what we call the built environment. Are there hike and bike trails? Is it safe in your neighborhood to go for a walk? That's really important.
Sure.
So, there are lots of important things that go towards physical activity and nutrition, and policy can affect all of that.
Yeah. Yeah, it's interesting because in the I guess the public debate, so many folks most people have strong opinions on just about anything, but when it comes to government assistance, I think we should all agree that government assistance should not go towards alcohol and cigarettes.
That's a pretty easy one, yeah.
Yeah. Now, when it gets down to potato chips, we could have an argument, and maybe some kind of debate. But it would be interesting to go through a list of grocery items.
Right.
And what are the items we all agree on the government should stay out of?
I don't know if there are going to be many of those. But yeah.
Exactly. So that's interesting. And you're talking about how policy isn't just food, although it is health policy or obesity. It can be, hiking and biking trails and things like that.
That's right. I mean, you may have heard of smart growth policies, right? Not saying pro or con here, but these policies try to really develop very walkable communities that are inviting.
Sure.
Trail development. I mean, we have wonderful trails around here, I think, and we're getting more of them, thank goodness. Some of the trails on the mountain are really good for like mountain bike riding. Some are great just for like taking a hike. But there are plenty of people who don't want to climb that mountain.
Right.
So, putting a trail in a neighborhood, okay, well, that can be great for the bike rider too. But hey, these people are already hiking and biking. If you can use like trails to connect people where they live to where they really want to go on a regular pattern, there's ideas that well, maybe some of them will choose to walk to the store instead of jump in their car and drive those few blocks and just get
Oh
some steps in
man,
that night.
Dr. Kelly, you're hitting on my passion project. We're gonna make America walkable.
There you go.
Let's do
Make
it.
America walk
Yeah,
again.
it's a it is a subject that has come up on this program multiple times. Anytime local politicians come on, I want to hear how they're making the city walkable. It is interesting how America is such a strong automobile culture, but I'm going to get on my soapbox here for a moment. Is that okay?
Yeah, sure.
Whenever you go on vacation and you have a great vacation, you come back. Usually it's because you went to a place that's walkable. It could be Disney World.
Yeah.
It could be Europe. It could be a beach community, maybe in Florida. Whatever the case might be, when we're on vacation, we love it when it's walkable. And somehow in the cities we live in, we miss that, and they aren't as walkable as they could be. So,
I think that's particularly true for like these Sunbelt cities.
Yeah.
You know, they're built later, so you know we didn't have we have horses, but I mean you're not really using those for reliable transportation or
Right.
walking. Like Europe, I mean like those cities were built before cars, right?
Sure.
So
Yeah.
there you go.
Yeah. Yeah. So I love this conversation about making a city walkable. I think that there genuinely is joy in, like you said, just walking to the store to pick up, you have a couple ingredients you need for dinner. Making a 5-minute walk, that's way healthier than ordering it over the internet, which is, before it was a big deal to drive to the store and park farther away from the entrance. Now you don't even need to do that. You can just sit at home and it'll be there in 20 minutes,
Right.
delivered. So
Well, I mean, there's great things going on in El Paso for that, and I'm not here as a representative of our health foundation, that's the Paso del Norte Health Foundation, but one of my early projects was getting this Playa Drain Trail started, and that runs from Riverside High School to Escarte Park, kind of in that area, and the local politicians and others have really gotten together and behind like, hey, let's make this trail longer.
That's awesome.
And put chapters to it. So there are places where bikes are like, okay, I can really go fast, and then there are places that are like really going by churches and parks.
That's great.
And schools. Kids use that trail to walk to school again. And it used to just be some dirt around the drainage ditch. And when you can remove blight and replace it with something positive like that, that's just, I mean, it's good for the people who live there, of course, but these trails are great. You can just drive down there if you want to with your bike and ride too.
Right. So I might have missed what you were saying, but the Paso del Norte Foundation is a part of this?
Yeah, so we kind of did some seed funding and master planning, and I can't recall the website name, but there's a website for the Paso del Norte Trail.
Okay.
Just Google that, and it'll show you the sections and the master plans for the city, and yeah, it's a pretty great project, I think.
Very cool. Well, I want to dive deeper into the whole conversation about diabetes, about policy, about what's happening here in El Paso, also just Texas in general. But first, we do need to take a break. If you're just joining us, we're with Dr. Michael Kelly. He's over at the Paso del Norte Community Foundation. He's part of the Texas Diabetes Council. We're talking about, well, really, what is it? Like health education, health awareness, health planning. How would you term this whole big subject?
Yeah, we spend a lot of money in health care, and we spend quite a bit less in the prevention of disease and kind of the early detection and the promotion of health. And that kind of area is where I'm in.
Okay.
So that's like, look, how do I keep you from needing to go to the hospital, from needing that new surgical robot or whatever? How can I keep you healthy?
Yeah, love it. We do need to go into a break. This is your daily reminder that 915 Talk is a production of Desert Voice Media. The website is desertvoice.media, and you can listen to this or any previous 915 Talk conversation. Appreciate all of you who listen. And if you listen to snippets of these conversations because maybe you're picking up your kids from school or you're running around after work or whatever the case may be, would love it if you found the 915 Talk on podcast format. We are on Apple Podcasts, we're on Spotify, iHeart, and you can just kind of scroll through all the different conversations we've had, and would just love it if you found 2 or 3 that you found to be particularly interesting. Listen through those. We love to get your feedback on the kind of conversations we're having as we learn to love our city, love our neighbors, and give God all the glory. And you can use that contact form on the desertvoice.media website. Whatever the case may be, we so appreciate each and every one of you who listen, who are joining us in this journey. We're going to go into a break. Do not touch that dial.
We'll be right back. Don't touch that dial.
915 Talk is listener supported and is a production of Desert Voice Media. That's right. It's people just like you who make this program possible. Together with Desert Voice, you can learn how to better serve our neighbors and pray for our community. To become a Desert Voice Media partner, you can visit desertvoice.media. That's right. That's the website, desertvoice.media. Take a look and join us today in reaching our Borderland for Christ.
Here's another encouraging story from thechristianheart.com, the ministry that highlights how men and women display their love for Jesus in their day-to-day lives.
Kristen Stirk has overwhelming medical issues. She was diagnosed with a rare heart condition at 17, underwent several open heart surgeries, and later faced the heartbreak of a miscarriage. Told she'd never be a mom, she miraculously became pregnant and delivered a healthy baby girl. But just days after giving birth, she faced heart failure again and had even more surgeries. Now she's been diagnosed with leukemia and is undergoing chemo. Despite the hardships, she's found tremendous peace in her Christian faith. She feels God wants to use her trials to help others, so she started a blog to show how God's grace has sustained her through all this. She hopes her writings will inspire and strengthen others on their own faith journey.
To enjoy hundreds of other inspiring stories of people living out their faith, go to thechristianheart.com.
Important announcement. You can now feed your mind, feed your soul with the KELP radio app. Listen to your favorite Christian teaching and talk programs on your smartphone from anywhere in the world with the KELP radio app. You can download the app on your app store now.
We're back. You're listening to 915 Talk.
We are back, and you're listening to 915 Talk. I'm your host, Andy Freck. Today we're with Dr. Michael Kelly. He's over at the Paso del Norte Health Foundation here in El Paso. He's also a part of the Texas Diabetes Council. And it's fun. You have a doctor of philosophy in health education.
That's right.
What is the philosophy of health education?
Okay, well, we can talk about that, but let me tell you. So PhDs they're called doctors of philosophy. I think I had one philosophy class in my undergraduate years.
Okay.
So I may be able to talk you to death, but I don't know that much about philosophy.
Okay.
Okay. So it's just a way of saying that's kind of your terminal degree, or your highest level of degree, typically a research emphasis, and then in a subject area. And health education is really the application of psychology, biology, education, and a few other disciplines to facilitate voluntary behavior change.
Okay.
So, we're not into coercing people to do something maybe they don't want to do, but we try to set it up to make it kind of an easy default choice in their lives, healthy things. We try to remove barriers that would stop them from doing healthy things. And put some encouragement in place.
Okay. So what are some examples of what that would look like?
So I think about, let's see, what would be a good one there? When I think about smoking, and, a lot of my health education friends are like, look, we shouldn't ban this for adults. This is a legal product in the United States, and if someone chooses to use it, an adult chooses to use it, That's a free will decision in their life. But we do need to tell them about, like, this is the only legal product that used as intended will kill you. So we suggest not doing that. And then, you may ask questions like, I was a big supporter. I helped lead the effort years ago to make El Paso smoke-free. That was one of my projects. And, some of my health education friends would say to me, how can you do that to people? You're removing choice. And I'm like, okay, so I'm removing some choice, but this isn't just about preference. This is, for me, about the workers' rights, right? Because it really, a lot of this started with airline attendants saying, look, this whole cabin is full of smoke, right? I don't care if you sit in the non-smoking area or not. And you may have an hour flight, but I have 8-hour days for 20 or 30 years working in this stuff.
Sure.
And then I think about some of the restaurants and bars, and the bartenders and servers and cooks even, they don't have great insurance typically to take care of the cancer that's looming. Right. So let's protect them, and let's protect other people that are in these public places.
Yeah.
It's about that kind of.
Right. I fortunately started traveling international when it was kind of on the tail end of allowing smoking. But I can remember my first transatlantic flight, Dallas to Frankfurt.
Yeah.
There were people smoking, and I was looking at these curtains.
Yeah.
I'm like, completely useless after I forget how long the flight is, 9 hours or whatever. Completely useless. We might as well all have been smoking.
That's right. That's right.
And you bring up a very fair point. The flight attendants, they have to work in a smoke-filled environment. They don't have a choice. And so where do you go from there? So El Paso becoming smoke-free, what were some of the hurdles there?
A lot of it had to do with the, hey, you make your own choices, let free economics reign. And those arguments really resonate with me. But you just got to weigh, like, other people's rights. And today, man, the younger people today probably can't even remember a restaurant where you walked up to the front and the hostess said smoking or non-smoking.
Yeah.
Right? I mean, like, if we introduced one of those back in this city, I mean, like, how many people would go to that?
Yeah, I was thinking about this recently. I was like, I can't remember the last time I even saw someone walking down the street and smoking.
Yeah.
I'm sure I've seen it, but it's not anything like it used to be. And from what I understand, you're not even supposed to be on a public sidewalk smoking. And so it is interesting how I would imagine at the time when that conversation first came out, how difficult it was to have those conversations. People are pushing back, and now it's just
a lot of it was business community, the restaurant, bar, taverns, associations, and they were afraid that they're going to lose their business.
Sure.
And you put a lot of hard work in your business, and you don't want government policy coming in and messing around with you. That's totally understandable. I don't think any of them closed, though, because of this smoking ordinance. And, some of the smokers, we did surveys back in the day and asked people, would you support this? Kind of theoretical. You don't really know till you're there. And even some smokers are like, yeah, man, I smoke, but when I'm actually eating, I don't want the person next to me smoking, right?
Yeah.
So even smokers at the time, a minority of them, but some, didn't want the smoke in the restaurant, and like almost all the non-smokers.
Yeah.
Yeah.
I don't know of any non-smokers who appreciate eating with cigarettes.
Yeah, that's secondhand smoke. So
right.
Your firsthand smoke is you draw it in. Your secondhand smoke is you're breathing out of the air. What a lot of people don't hear is third-hand smoke. So if you get this stuff on
third-hand smoke.
Yeah, third-hand smoke.
Okay.
So that's like, okay, so you imagine yourself like maybe you have a baby at home, right?
Okay.
And you're kind of holding them next to your neck and coddling them and stuff, and maybe getting ready for bed. if you've been out and you've got all that smoke in your jacket, we all know that your clothes stink like smoke, right?
Sure.
When you get home. So yeah, it's there. And now you have someone close to you breathing that off your clothes. And you can definitely tell when you went into a hotel room or in someone's house where there'd been a lot of smoking.
Yeah.
So you're picking it up third hand. So the cigarette doesn't even need to be lit in those cases.
Wow. Yeah, it's interesting. Again, kind of repeating what I said earlier, but this idea that these conversations can be difficult in the beginning because, as you were saying, the fear of restaurant and bar owners, which is understandable. What is a diet question now that maybe is difficult for people to have, but you think will be normal in the future?
Oh, diet, that's a hard one. That is a hard one. I mean, I can remember when, eggs were good for you and then bad for you, and then I think good again. And I'm not sure where they are today. Yeah, milk kind of goes the same way too.
Yeah, that's funny.
Right. So, man, let's get a balanced diet going. And
Right.
I think a lot of people are pretty smart to know, like, hey, let's not eat too much of that food. I'm not going to
Yeah.
call it out right
Yeah,
here,
yeah, yeah.
any particular industry or restaurant,
Sure.
but. Yeah, I think when it comes to obesity and something that is going to be a little more normalized and understood is that obesity is a disease and that some of the new medicine on the market is not just a shortcut. It's not the kind of the right now expensive way. I mean,
Right.
that stuff can cost like easy $500 or $800 a month if you don't have insurance.
Right.
But it really is dealing with some fundamental metabolic issues that we don't fully understand. So I think we just need to be a little humble in there, and
Yeah.
maybe a little less proud of like, okay, well,
Yeah.
I'm not giant. I think, okay, good for you.
Yeah. Yeah, that's so important. I want to continue this conversation, but we do have Charlie 1 on the phone. Charlie 1, what are you seeing out on the roads this afternoon?
Not doing too bad. The freeway okay as opposed to a little bit earlier when we had that crash there at Porfirio Diaz. But everything's okay there. They cleared the freeway there. But, excuse me, what we have right now is on the east side a crash. George Dieter and Treewood, we have a crash. That's George Dieter and Treewood. We go downtown, Yandell and Williams, we have a crash there. In the valley, Yarborough and North Loop, that crash just happened. PD en route, not there yet. Not PD controlled, Yarborough and North Loop. Then on the west side, North Desert and Thorn, we have a stalled car in the intersection there. While we're on the west side, transbound westbound lanes at Restler, the left lane taken away. They're doing a lot of construction there. And where we still kind of tapping the brakes, but that's normal. I-10 East Piedras through the Reynolds area, kind of tapping on the brakes there once in a while, and just caution there. And Andy, back to you.
Charlie 1, today we have Dr. Michael Kelly in the studio. He's over at the Paso del Norte Health Foundation, and we've been talking a little bit about a healthy diet. And I know we can argue about a lot of different foods, whether they're good for us or not, but I think you'll agree menudo is a great breakfast option. And so where would you recommend that folks go out to try menudo for breakfast in the morning?
Yeah, menudo, that's kind of, it's not like having steak or hamburger or something like that. It's it fills you up kind of nice, but with that hominy in there, and it's, there's a few, what you call tripe in there, but that's just a few scattered in there here and there. But the spiciness of it, the taste of it, that's what's really gonna win you over. And that's you can get that delicious menudo. They're open at 7:00. Me, Perlita Cafe, 3120 Treewood. Andy.
Thank you, Charlie 1. We'll talk soon. And we're back with Dr. Michael Kelly. He's over at the Paso del Norte Health Foundation. He's also on the Texas, the Diabetes Council. So before we went into the traffic break, we were talking about obesity, and what I heard you say was, first of all, pharmaceuticals are not a replacement for healthy diet and exercise, is essentially what I heard you say.
Yeah, well, they're not a replacement.
Yeah.
You still need to be physically active. I mean, if you take this stuff and you start losing some weight, you're going to lose muscle mass unless you're lifting weights and active and getting enough protein and a good balanced diet. So,
Sure.
it's going to be helpful, and there's going to be new stuff coming out. Next year, there's already new medicines scheduled. We've got them in pill form already. You don't have to take the injections anymore. I'd go see your doctor if you are a really heavy person or have type 2 diabetes. This stuff looks quite promising. We don't know what the future holds. Sometimes things don't go the way you want them.
Exactly. Yeah, and the second point you made was you said something about humility and obesity. Could you flesh that out just a little bit?
Yes, so I think for some people, if they have good health habits, if they have some pretty positive outcomes, maybe they have some genetics on their side, maybe they really have worked out really hard and done everything right. Be a little easier on your neighbor that maybe not has the situation that you have. I don't think we fully understand why some people are addicted more, why some people are really obese. I mean, we understand the mechanics. Yeah, they took in more calories than they burned. But let's just try to avoid some of that judgment.
Right. Yeah, that's very, very good. A thought for us to be just aware of, not to make those snap, knee-jerk judgments on our neighbor. We don't know what their life is like, and so I appreciate that. We do need to jump into the conversation on diabetes. You're on the Texas Diabetes Council. We kind of started our conversation at the beginning of the hour about that, but you were talking about some of the policies or direction that you think Texas will be taking in this regard.
Yeah. We're hearing nationally that some of the new medications, trizepatide, the Ozempic, the semaglutide, and certainly others are going to be available at a better price, and that's going to help a lot of people with diabetes. These medicines are first and foremost really designed to help manage diabetes, and they do a really good job at it. And they manage diabetes independent of weight. So the weight loss is a great side effect, but you don't need to lose the weight to manage the diabetes. The diabetes gets managed as the weight is coming off. You can use them straight for weight loss too, and of course they're very effective there. So diabetes, the classic types, we used to say, juvenile diabetes?
Sure.
That's type 1.
Yeah.
And then adult onset, that's type 2. But there's a lot of younger people now with type 2, and sometimes type 1 comes on later in life, in your 20s or 30s. And we're discovering a lot of subtlety here, patterns. There's a diabetes we call LADA, and LADA, and it comes on a little later in life, kind of looks like type 2 maybe, and then slowly goes wow, you're going to need insulin here really soon. This could be type 1 coming on. We don't know what to call this exactly. But I've heard people call in type 3 diabetes Alzheimer's even. I mean, there's some interesting stuff going on with diabetes. Most of our diabetes is type 2. We got a lot of it in the city. About 15% of adults have diabetes and know it. There are a couple points more, a couple percent of people that have diabetes and don't know it yet, but will real soon.
Sure.
So I would suggest they actually go to a medical professional, get checked out for diabetes. It's just a pretty quick blood test, and don't find out in the emergency room. Right?
Yeah. I don't pretend to know very much at all about diabetes, but especially when it comes to juvenile or type 1, what I learned is many folks find out just because they had to take their son or daughter to the emergency room, and that's scary.
It's painful too.
Yeah. So with all of this, where does health education come in?
Yeah, so health education comes in kind of way before all of this conversation. It comes in with how can we help people eat better, So quality of food,
Mm-hmm.
health education in schools, not just the service of food, but the teaching of nutrition to children. Certainly policies around the service of food is important. Changing the environment so that, I remember days where there was just the Coke machines and candy machines all over the school, and you don't have that today.
That's interesting. Yeah.
Yeah, so a shift in the in the environment can be really productive. So that's kind of where health education comes in. Let me help you choose behaviors, and there are behaviors that you can use. I just call them between the meals. That's like, well, you don't need to be eating and snacking during all those meals. If you can wait even when you're a little bit hungry and then eat a full healthy meal, and people go like, oh, I thought snacking all day may have been like a good thing as long as I wasn't eating candy, maybe nuts, right? Oh, well, nuts are great for you, and they really are. Nuts are great. I think they're good food. A lot of calories in nuts.
Yeah.
You're snacking on nuts all day. You're getting some good healthy fats, but you're also getting it with a lot of calories.
But you're also getting some good healthy fats.
Yeah. That's right. That's right.
Yeah.
So health education kind of comes in and says, okay, and when you're eating, there are things we can teach you about when you're eating. Set your fork down. Right? Talk with people and enjoy your meal a little bit more.
That's one I need to hear. I eat way too quickly.
You let it hit bottom. That's what my parents used to say. Like, hey, slow down. Let it hit bottom first. Don't keep eating.
Yeah.
But that's a kid eating like a dog like that.
Yeah. Well, hey, again, this kind of goes back to our conversation about smoking, where it was this crazy conversation, a few decades back, whenever that was, when smoking was taken out of restaurants.
Yep.
And now you're bringing up the point of you don't see soda machines all over schools anymore.
Yeah, and you don't see cigarette machines anymore.
Yeah. There used to be cigarette machines in schools?
There may have been in schools at one time before my time. But yeah, I remember going out to the restaurant and somewhere near the like cashier.
A cigarette vending machine.
Yeah, it's a cigarette vending machine. We'd play with them all the time and
Sure.
knew how to work them. My grandfather, don't you ever buy him menthols because you're going to be in trouble.
Wow. Yeah. It's funny because I think for a lot of people, when we talk about this kind of thing, it can be almost like scary. Like we're making changes. Well, we're getting healthier. And I don't know if this is the right word, but it definitely does feel like there's a diabetes epidemic in this part of the country, and we action does need to be taken.
Yeah, there are a few parts of the state, I think particularly kind of east of Dallas, there are some counties with even higher rates than we have.
Wow. Yeah.
But El Paso's rate is higher than the state and national average. Not good. I think what's even more alarming to me than that rate of diabetes is our outcomes. So diabetes can be managed. You get to it early with a simple blood test. My goodness, go get your physical. And, if you can catch that early, you may just hey, take this pill and you'll be good for years, right? Diagnosis doesn't mean that you have to take shots. Unless you're type 1, but I'm talking about the type 2 here.
Right.
So, yeah.
All right. If you're just joining us with Dr. Michael Kelly, he's over at the Paso del Norte Health Foundation. He's also on the Texas Diabetes Council. It's such a fun conversation because we even talked about walkable cities.
Yeah.
Talked about trails. It's super fun to dive into all these things.
And we have a resource in town, the El Paso Center for Diabetes. It's got a new building. It's over on Montana, near Hawkins, kind of across from Airline International there. And, they offer kind of diabetes work group class types of things. And you can go with a spouse. And they'll do an intake for you. They teach you a lot about meal planning, how to test your blood sugars, what's a healthy blood sugar range for you, physical activity. They'll do a meal plan just for you, your weight, your blood sugars and where you're at. And, I think if you have diabetes, type 1, type 2, give them a call, the El Paso Center for Diabetes, and just say, hey, I heard that you have some help for persons with diabetes, and you can take kind of these group classes, or you can just go in for kind of one-on-one counseling with these registered dietitians, and they can really walk you through your meal plans with a loved one and, help you get some blood sugar managed.
Yeah, it's one of those. It's another recurring theme on this program. Let's be humble enough to learn, and let's be humble enough to ask for help.
Yeah.
And so you're mentioning the El Paso Center for Diabetes. I pulled it up. It's epdiabetes.org, and they're at 8700 Montana. As you said, it's kind of right on pretty close to the corner of Hawkins and Montana. Yeah. So. What do we call that? Central East?
Sure, Central East.
Central East El Paso.
And they have a nice campaign on there. It's called the Now What campaign, too. So if you're just that kind of person who's like, well, I'm not driving over there, lots of videos, a risk test online. So if you're like, oh, I don't think I'm at risk. Well, I mean, like, just listening to this radio show, you can pull out your phone right now, go to that website, and take a risk test for free. And you don't have to put in your email or anything unless you want to and get it emailed to you. And it'll give you a number and say, hey, your risk is high, medium, low. And
Yeah, love it. We do need to go into a break. Before we go into the break, this is just our daily note of gratitude. It's Thanksgiving month, so KELP Radio would like to thank our impact partners. These are local businesses, nonprofits, educational institutions that have joined us in our journey to serve the city through radio. And today I would like to thank Alamo Glass Pros. Alamo Glass Pros is over on the east side of El Paso, but of course it's if you need a windshield replaced, if you have a crack in your windshield, what do you call it when a rock hits it? Not a nick, a dent.
No,
not a dent, but they'll help you out. AlamoGlassPros.com. Also, if you want to tint your windshield, particularly in the Sun City, that makes driving much more enjoyable. It's funny. I drive a car that is not tinted, and I always have to wear sunglasses. Then I got in a car where it was properly done. And it wasn't like I was dealing any illicit product. It was a light tint, and it made the drive so much more relaxing. Also, they do windows for commercial and residential, but it's AlamoGlassPros.com. Really, really good folks over there. So appreciate them and all they do. AlamoGlassPros.com. We're going into a break. We'll be back with Dr. Michael Kelly. Do not touch that dial.
We'll be right back. Don't touch that dial.
Greetings, KELP listeners. This is Terry Gray, pastor of Calvary Chapel, Sun City, and speaker on the Summons broadcast heard each weekday at 5 p.m. right here on this station. Calvary Chapel, Sun City is located at 960 West Borderland Road on the west side of El Paso. We hold services on Wednesday evenings at 7 and on Sunday mornings at 9 and 11. If you are without a church home, we would love to have you join us for worship and Bible study. You can find out more information about us on the web at www.ccsuncity.org.
Do you have a special prayer need in your life? Or maybe you know someone, either a loved one or a friend, who is in need of prayer. Would you like us to pray for you? Well, call Saturday 915-779-0016 between 1 and 2 for prayer and answers. Also, if you would like answers to biblical questions, give us a call 915-779-0016 during that same time period. Thank you, and God bless you.
Greetings, KELP listeners. This is Terry Gray, pastor of Calvary Chapel, Sun City, and speaker on the Summons broadcast heard each weekday at 5 p.m. right here on this station. Calvary Chapel, Sun City is located at 960 West Borderland Road on the west side of El Paso. We hold services on Wednesday evenings at 7 and on Sunday mornings at 9 and 11. If you are without a church home, we would love to have you join us for worship and Bible study. You can find out more information about us on the web at www.ccsuncity.org.
We're back. You're listening to 915 Talk.
We are back, and you're listening to 915 Talk. I'm your host, Andy Frecka. Today we're with Dr. Michael Kelly. He's over at the Paso del Norte Health Foundation. He's also on the Texas Diabetes Council. We've been talking about obesity, diabetes, health education. Dr. Kelly, with all of this, you are part of a foundation. Where does nonprofit leadership fit into all this conversation?
Yeah, so nonprofits overall in El Paso, I mean, they're all different types. So your local church is a nonprofit, your booster club at school is a nonprofit, but we probably have maybe 100 or so really good size, just kind of social service health nonprofits as well. So, we can think about some of the big ones, the YWCA, the YMCA, right?
Okay.
The Boy Scouts and Girl Scouts, right?
Sure.
Those are some common names. We have like the Food Bank is a nonprofit. We have a child guidance center, all different size and purpose nonprofits. I deal with ones mostly with health and humans, but there are certainly ones for pets and the environment and others. I do most of my work through the nonprofit, right? So alone, I'm one person. But working with a nonprofit agency, and particularly if I have the resources of the Paso del Norte Health Foundation behind me to help with the grant funding, and that's a no small help, of course. That's a big help. We can change a lot of things. So we talked about earlier the smoking ordinance. Well, I worked with the American Cancer Society and the health department to get that done, right?
Sure.
We've talked about trails, and of course we work with the city, but we also worked with trail nonprofits and a local bike nonprofit and others to get that particular thing done. So all our work, our diabetes work, we've mentioned the Center for Diabetes, nonprofits, and they're part of our economy, and to make nonprofits work, you need a real functional board of directors.
Okay.
And, a board of directors at a nonprofit is kind of what it sounds like, right? It has a president, a board, a vice president, secretaries, those kind of things. And they manage the executive director. They look over the finances. They help raise money many times. Some are working boards where they actually hey, go in and box the food or help with the pet or whatever it is, right? Those are generally a little smaller ones. And then you have staff at particularly the mid-sized to larger ones, an executive director, a program person, a finance person, all these different types of staff, just like a regular for-profit business would have. And I help lead and direct leadership programs for both those boards and the staff there. So our board leadership program is offered both in southern New Mexico and in Juarez, where we work, and in El Paso, of course, through some nonprofits. And it helps the board of directors understand their basic responsibilities as a board.
Okay.
And how to execute those, right?
Right.
Like how is your relationship with your executive director? How do you raise money? What is a 990 form that you're filing for your nonprofit? And you're responsible for this. So, hey, get on board and start to understand.
Right.
Yeah.
Yeah, we were laughing during the break. I said, this is such a huge conversation. I know we have many listeners who are in the nonprofit space, and I feel like we could have a whole program talking about nonprofit leadership. But when it comes to a nonprofit board, could you name one or two signs that the board is healthy?
I think that they have really good trust with each other and with their executive director.
Okay.
And trust isn't just like, oh yeah, I trust you. It's like purposely built, and we can teach you how to build that trust and gain trust with each other to get things done. And it's earned.
Okay,
It's earned, but it's also given.
Give us a teaser. What's one way, maybe not the most important way, but one way to build trust between an executive director and a board?
Yeah, when the board asks the executive director for something like, hey, can I see last month's finances or something like that, tell them why. Tell them why. Right? I mean, because we all make up, oh my goodness, they've found an error and they're going to fire me. And, you probably feel this even as staff.
That's
like,
so
someone
good.
asks,
Yeah.
just say, because I wanted to tell a friend how much money we're raising. Oh, thank goodness. That's such a good use of that. I thought you found an error, right?
Right.
But that's just one.
Okay, I love that. So that's such an obvious, simple but powerful point, and I want to just rehash it to make sure that we got it right. If you're on the board of particularly of a nonprofit, I would say, and it could be a church, a school, whatever the case would be. If you're asking for a financial report from your executive director, tell them why you want the report.
Right. Just say why you want it, so I can look at our income and accurately tell my friends how wonderful our fundraising is. Right? Because normally it is for good, right?
Yeah.
And it could be the other way too. The executive director asking the board. It could be asking a staff person. And I guess face to face, it's a little easier to say that. But in a day when we're texting each other, and you just text someone after work and go, "Hey, tomorrow morning, can you get me that financial report? I need to look at it."
Yeah.
You don't even say I need to look at it. Can you give me that financial report? Send. Right? We're so short.
Yeah,
man, we make up the rest of that conversation all night.
Yeah, we miss exactly miss the emotion or the real heart piece behind that.
Yeah.
So healthy board, trust. What are some of the other things? Just maybe a couple.
Yeah,
other
well, I
simple
mean,
things.
so for our executive training, we train executive directors to be better executive directors. We're not going to fix the bad ones, but we can take some good ones and really accelerate them. And one of my favorite questions I like to ask when we start this training is, what kind of leader are you? And many of them have this like, oh, I'm a this kind of leader. And they say servant leader. They'll say I'm never a micromanager. I never give detail. Or, I always tell them to do this and give them good motivation. You got to cheer your employees on. And it's like, yeah, well, your people are at different need levels all the time. And if you're just offering that, whatever that is, and that's what your leadership style is, you're not modulating appropriately, because every situation. And not every person, every person, yes, but every person in different situations need different things. And it's up to you to be able to kind of figure out like, oh, here this person does need some tight management. Here they just need to be let go. Here they need some public thank yous, these types of things.
Right. Okay. If someone's interested in that training, where can they find it?
Yeah, we offer it every couple years. Okay. So you can go to our website, pdnhf.org, and it's our PDN, like Paso del Norte Health Foundation. .org, and you can go under our programs. That's kind of like what we do, and it's our Realize Executive program.
Okay. And
there's also kind of in that area. Is some information about our board training. And you can also call the United Way of El Paso County, and you can go to Realize, the board training website that they're managing right now. And we have classes nearly every month for your board to kind of go through. They're kind of lunch and learns.
Yeah.
And if you're a board that says, hey, we want to learn. Maybe you're having a particular problem you want to work through. Maybe you just like being together and learning.
Yeah.
Call that United Way of El Paso County, and they'll deploy some trainers out to the nonprofit to kind of teach your board, whether it's finances or how to run a smooth board meeting or dealing with an executive director or whatever it is.
Right. Yeah. Okay. pdnhf.org. I'm going to put in my 2 cents. Being on a board, I think, and you can correct me, is more than just finding things wrong with an organization in a meeting. It requires positive input. It requires action, and not just giving your opinion at a meeting once every month or quarter or whatever the case may be.
Yeah.
And there is real responsibility there. outside of giving your opinion. So I've just seen that in so many different areas where you mentioned boards jumping in on the fundraising part, or at a food bank boxing food. That's to me is a sign of, and I do want to say there are so many healthy boards out there that are doing those kind of thing, and I hope that these kind of conversations will inspire all of us to get better at all those things, because these nonprofits are doing important things. Dr. Kelly, you're in the health education space. If you could put up a billboard on I-10 for everyone to learn one thing, what would that billboard say?
Eat better and exercise, I guess. I just never forget every time we take our dog to the vet, what have you been feeding this dog? And we need to ask ourselves that question. What are we feeding ourselves? And just stay healthy. But there's so much there. Sleep, stress, super important. Family relations, super important. Mental health. It's all there. Don't smoke, don't drink.
So good. And we have less than a minute left. At the beginning of this program, we say in the intro, the world is looking at El Paso. What will we say to the world? Because we here in El Paso need to represent ourselves and not just depend on national media outlets. You've made the Borderland your home now for over 30 years. What is one thing you want the world to know about El Paso?
I think it's a beautiful weather, sunny city, and this is where you want to be if you don't want to pay San Diego prices and still want to have great weather.
San Diego weather without the prices.
There you go.
We just need to figure out a way to bring the ocean, the beachfront.
That's true.
Thank you for joining us today. We've been with Dr. Michael Kelly. He's at the Paso del Norte Community Foundation. He's also on the Texas Diabetes Council. A very fun and useful conversation. And as we always say, let's learn to love our city, love our neighbors, and give God all the glory. This has been 915 Talk. You have been listening to 915 Talk, a production of Desert Voice Media. In order to listen to previous editions of 915 Talk, just visit desertvoice.media. Let's learn together to love our city, love our neighbors, and give God all the glory.
Hi, I'm Johnny Erickson Tata, and I love that old classic Tony Bennett song called I Left My Heart in San Francisco.